Hello doctors, welcome back to our channel. Today we are going to see about heart sound and some pathology of it. Okay, let's get jump to it. What is heart sound? It is referred as the sounds produced by the heart during each cardiac cycle due to snapping of the valve and the blood flow through its chambers. So the sounds can be heard using stethoscopes or phonocardiogram. Where to check? We will check on the anterior thoracic wall. On anterior thoracic wall, we have 5 auscultation points. The mitral point. It is located in the left fifth intercostal space along the mid-clavicular line, which helps to assess the mitral valve. The next is aortic point. It is located in the right second intercostal space along the sternal line, which helps to assess the aortic valve. And next comes pulmonic point. It is located in the left second intercostal space along the sternal line, which helps to assess the pulmonary valve. Next comes tricuspid point. It is located in between 4th and 5th intercostal space on xiphoid process, which help to assess the tricuspid valve. There is another point which is called Erb's point. It is located in left 3rd intercostal space, which helps to assess the overall the heart sound and best to hear the murmur of the left side. In mitral and tricuspid point, S1 is louder than S2, whereas in aortic and pulmonary point, S2 is louder than S1. The high-pitched sounds are heard by diaphragm side of the stethoscope, and the low-pitched sounds are heard by the bell side of stethoscope. There are only 3 low-pitched sounds. Those are S3, S4 and tumor plop sound. Remaining sounds are high-pitched sounds. By the way, I will explain the tumor plop sound later on this video. The interval between the S1 and S2 is systolic phase, and the interval between the S2 and S1 is diastolic phase. Okay, let's figure each of the heart sounds in cardiac cycle. Assume this is a heart. During atrial systole, atrium start to contract, so the pressure in the atrium rises. This will lead to open the mitral and tricuspid valve and the blood flow into the ventricle. In the next few milliseconds, the ventricle is filled with blood and starts to contract. This will make the pressure in the ventricle much higher than the atrium, but not higher than the pressure in the aorta or pulmonary artery. So the mitral and tricuspid valve will close. This will make the ventricle as a closed chamber. This phase is called isovolumetric contraction. Due to snapping of the valve causes the S1 sound. In next few milliseconds, ventricle is still on contraction. So the pressure in the ventricle become much higher than the pressure in the aorta or pulmonary artery. So the aortic and pulmonary valves will open and the blood rush into the aorta or pulmonary artery. Rapid ventricular ejection happens. In this moment, ejection click sound here. In next few milliseconds, the ventricle starts to relax. So the pressure in the ventricle decreases. So the aortic and pulmonary valve will close. But the ventricle pressure is not reduced than the atrium. So the mitral and aortic valve are still closed. This makes ventricle again a closed chamber, but this time during relaxation. So this phase is called isovolumetric relaxation. Closure of the aortic and pulmonary valve causes the second heart sound. In next few milliseconds, due to ventricle relaxation, the pressure in the ventricle decreases. This causes the opening of the mitral and tricuspid valve and blood flow into ventricle. This phase is called rapid ventricular filling. Due to the opening of the mitral and tricuspid valve, we hear opening snap sound. Okay, let's see some pathologies. As I mentioned earlier on this video, we shall talk about tumor plop sound. This is heard on atrial myxoma. In atrial myxoma, pedunculated tumor present in atrium. When the mitral and tricuspid valve opens after the isovolumetric relaxation phase, so the blood rushes into ventricle. This makes the tumor to hit on the valve, which causes the tumor plop sound. It is heard right after the opening snap. In case of mitral valve prolapse, we can hear mid-systolic clicks. In case of constrictive pericarditis, we can hear pericardial shudder sound during S3 sound. I want to ask you a question. There are 2 valves, but why we hear one sound? If you know the answer, comment below. If you want to know, follow this video. Actually, there is a time lag between the closure of each valve, but we don't hear it because the time lag is very minimal. So we hear it as a single sound. The time interval between aortic valve closure and the pulmonary valve closure is nearly 30 milliseconds. It is best heard on Erb's point during inspiration. In case of atrial septal defect, presence of wide fixed split of S2. In other case, ventricular septal defect or mitral regurgitation, presence of wide variable split second sound. In left ventricular failure, presence of narrow split second sound. Let's see what happened to the S1 during mitral stenosis. During mitral stenosis, blood take long time to fill from the left atrium to left ventricle. So the mitral valve close later. So we can see narrow split first sound. If it is progress, the closure of the valve takes even later. So the split is even narrower. If the disease progress, we can hear reverse split sound. Thank you for watching. Hope you see on the next video.